Today we're honored to welcome Len May to the show. How you doing?
I'm doing great. How you doing?
Yeah, as I was saying, I'm really excited about this. You got a wide array of expertise. You got a lot of knowledge in this area, and I'm very curious myself. How did you get started in this? Like, what was your story, and how did you get on the path of helping people?
I think in order to help people, you got to help yourself first, or try to find a way to help yourself. So I had an interesting journey. I was the kind of kid that would sit in class, the teacher would call on me, and my mind would be elsewhere. So I was sort of drifting and daydreaming. And then I became disruptive because I wasn't really that interested. And my parents decided to take me to some doctors, some psychiatrists, and they diagnosed me with ADD, attention deficit disorder, when I was around 14. So that's when you get diagnosed with a disorder, you feel something is wrong with you, and that was my perception. And that really doesn't mean anything is wrong with you. It's just your mind processes things in different ways. So being able to go through that journey and try to figure that out, that sort of was my entry point into personalized health and wellness. Uh, Also, alternative medicine, plant medicine, etc., getting off prescription medication. So, like, they prescribed me some medication, and I can't say it didn't work. It all depends on how you define work. It allowed me to focus, but it took away any connection of self. So, my emotional sense of self, my feelings, all that were numb, and I would just go through my days. And to be completely transparent with you and your audience, I was going through. I was in school, hanging out early with a couple of friends. They asked me if I wanted to smoke a cigarette. I was like, "Yeah, sure, man. I'll smoke a cigarette with I'll be cool with these other kids." And they had one cigarette, which I didn't question. They passed it around. I took a drag, and like it didn't taste like a cigarette. To me, it tasted different. And I took another drag. They're laughing at me, but they put cannabis in the cigarette. So when I went back to class, the windows that were constantly open in my head sort of narrowed, and I could focus. So it allowed me to get off of prescription medication and sort of use plant medicine to self-medicate.
Very interesting. So it kind of sounds like your own story of getting you into this, into the genetics and all that. Um, I'm very curious. Like, what is the difference between genetics and epigenetics?
Yeah, it's a great question. So, just to take my story a little bit further on how, like, I started EndoDNA, uh, the first foray was an endocannabinoid system test. And the reason for that is, I was able to go to university. I had a pretty successful career in corporate. I was a commercial real estate broker. I'm from Philadelphia, and I moved to Los Angeles. And these guys came in a real estate office, and they wanted to open up an alternative pharmacy. So nobody wanted to work with them. Uh, they came up to me and alternative pharmacy. What do you guys really want? Alternative pharmacy. What do you really want? A dispensary. I'm like, all right, fine. I can help you. Where's your paperwork? You have to be compliant. They didn't know what I was talking about. So, long story, a little bit longer. They offered me a partnership. So I became a partner in dispensary, and we ended up opening multiple dispensaries. And one of the things I kept seeing was two people will consume the same chemical variety and have a completely different experience. And so I started getting into plant genomics, and I left the company, went to work with a company called Medicinal Genomics. We did genetic sequencing of the plant. And I could see that we're calling these plants different names, but genetically there's alignment or misalignment. And I got into the parent company, the company that I was working with, was doing what's called pharmacogenomics, which is a study of how drugs affect individual bodies, and also drug to drug interaction, how they're metabolized. So my light bulb moment was, we have plant DNA here, we have human DNA here. Let's bring those two together and guide people to a personalized experience. And that's what we did when we originally launched EndoDNA in 2017. They had no interest in it, so we were able to get some smart people, scientists, and bring them into the fold, and then launch that in December of 2017. So our first foray was an endocannabinoid system test. The idea was to help people either mitigate or avoid a possible adverse event. And then we expanded from there into all kinds of different genetic tests, male hormone health, female hormone health, cognitive health, skin, nutrient, vitamins, etc. Now we're moving into whole genome. So to answer your question, I think I like to give an example of how DNA really works, and people really get, it's in my genes, so there's nothing I can do about it. Well, when we're born, we get 50% of DNA from our mother, 50% from our father. And if you think about it, you can visualize a big circuit breaker board with on-off switches. So a lot of those on-off switches are turned on, maybe 20-25% when we're born, and when we're children, really little babies. So like things like our hair color, eye color, skin color, things like that are turned on. But the rest of our genetic predispositions, what we're pre-programmed, are controlled by our lifestyle. So things that we put in our bodies, what we consume, food, exposure to heavy metals, pesticides, our own neurochemistry, so excretion of our own, cortisol, adrenaline, dopamine, those all control the epigenetic expression. That's the turning on the switch of what you were genetically predisposed to. So when you have a gene of predisposition, you have encoding, that information goes to the cell tells it to make proteins and turn those on. The interesting thing is 99.9% of us are identical. It's a 0.1% that really makes a difference. And that 0.1% is our genotype. And that genotype is associated with, like computers speak in a binary code, ones and zeros behind the user interface. Genes communicate in 4 letters, a C, a T, an A, and a G. They're called nucleotides. The combination of those 2 letters on a what's called a single nucleotide polymorphism, not to get way too geeky and sciencey, but that is your unique genotype as it pertains to a symptomatic condition. So let's say that you're predisposed to alcohol dependence. It's in your family. We all, talk about it. We inherit that. But if you know this about yourself, and you may know this, from your ancestry, but if you know this about yourself, you can make a choice whether consume, whether not consume, or consume until you realize that maybe you epigenetically turn that predisposition on, and now your brain is, wanting to have that, alcohol. You turn on the dependence gene, as an example.
Very interesting. So, to my understanding, the genes are like the things that we're born with, and the epigenetics is controlled above the genes, basically lifestyle factors. Do I have that right?
Yeah, your lifestyle factors will control the epigenetic expression of your genetic predisposition. Correct.
Got it. Yeah, because a lot of people, even today, we're kind of believing that genes kind of control our destiny. It's almost like this victim mentality.
Yeah.
Like, I'm just going to get this disease. There's nothing I can do about it. Do you want to speak to that a little bit?
Yeah, I mean, if you have a predisposition to a certain disease, you can take specific action with your lifestyle to be able to turn on or off that epigenetic expression. So if you're predisposed to things like autoimmune conditions, so, different things like spectrum disorder or even gluten sensitivity, not celiac disease. But if you know this about yourself, you can take specific action. A lot of it has to do with food. Food and the things that we consume in our bodies control the epigenetic expression that we may be predisposed to. So, and it's not only genes, there's things like gut microbiome, there's all these different things that we can control based on what we're predisposed to. So I'll give you an example on gut microbiome. So when I did my gut microbiome test, it showed that I have a predisposition or that I have a genetic factor that makes me, or my gut microbiome makes me get inflamed with the consumption of things like bell peppers, for instance. So if you think about that, bell peppers, very healthy food, high in vitamin C, other nutrients, but to me, it's inflammatory. So if I know this about myself in advance, I can mitigate by consuming less, bell peppers or consume them cooked, etc. So when you know things about yourself, you can avoid your sharp corners. The way that I sort of describe is your genome is your GPS of life. So I can drive from LA to Philly without a GPS. Now I'm going to hit traffic jams, potholes, all kinds of different wrong way, and the same. But I'm going to get there eventually, hopefully. But when you know this about yourself, when you have your GPS, you know which roads to take and which roads to avoid. So this is why it's really important to understand your genome so you can follow that accordingly based on your predispositions.
That makes sense. I mean, I feel like it can just be very empowering information to know that we can actually control the outcome of our disease in a sense. Like we can actually influence it through our lifestyle factors, and that right there is so empowering for people. I mean, I remember when I first learned that, it's like I kind of already knew in a sense because it just doesn't make sense just to have like genes control everything. But then learning the science behind that, very powerful.
Yeah, we talk about things like biological age. We talk about different things like that. Well, in order for you to control the epigenetic expression, you want to know what you can turn on and off. Otherwise, you're driving blindly. And your genome is the first phase of that. But there's other things, other factors, and just because you have a genetic predisposition to something, it doesn't mean that it's going to epigenetically express. Because there's other factors. I'll give you another example. So I get really stressed when I have to get a blood test. Now, it's not the needle, I'm all tattooed, so it's not the needles, but there's something in me that makes me get lightheaded. I get extremely stressed. So last time when I went to get my physical, I had my blood work done, and it was extremely stressful for me. When I got my results, my blood glucose level was high. Now, I don't eat sugar. I don't eat meat. There's a whole bunch of things that I don't eat. But when I go to a doctor or a healthcare professional to practice a sick care, they would probably say, high blood sugar, we have a pill for that. We're going to have to reduce your blood sugar level. Now, or a glucose level. Now, when I work with a functional medical professional, the question was, okay, well, now I know that cortisol secretion can increase your blood glucose level. So because you were super stressed during that process, it turned on the expression of the cortisol, turned on that blood glucose level to compensate for that. So it showed a very high blood glucose level. If you're really concerned about that, we can prescribe a glucose monitor you wear for several weeks, and we can see and track that. It's exactly what I did, and there was no issues with my blood sugar level because it was just a moment in time. So understanding the root cause of what is being expressed is really important, because if my elbow hurts, well, the options that I have if I go to a healthcare professional is I can give you a pill for that, I can inject that so you will not feel the pain. Or you can say, well, what is the root cause of the pain? I didn't play tennis. I didn't do anything with my elbow. Why is it hurting? Well, it could be, was I stressed? Is there cortisol? Is there something else that's going on that's making my elbow hurt? Because that is not the result. That is just a symptom. And pain a lot of times is a symptom that we try to mask and get rid of because we in the Western world, especially in the United States, are pain averse.
Makes sense because like tracking these things and seeing the real world data behind that, I mean, that just makes it that much more tangible for people.
Yeah, exactly.
So I know you do a lot of DNA testing and use AI with that. Is that right?
Yeah, so we have a patent on a machine learning algorithm. The AI doesn't do the testing. The AI does the analysis of the feedback loop as well. So the way that it works is you can ask it questions. So the machine learning algorithm will, since we train it with a bunch of our own LLMs and other systems and create guardrails for that, you can ask this healthcare professional can ask it, show me all lens inflammatory markers. Cross-reference those with any metabolic markers. Give me a treatment protocol that's more aligned based on those genetic factors. So the treatment protocol will be created. The healthcare professional can go and modify that treatment protocol and say, no, you know what? If it's hormone-based, I don't like transdermal hormone. I like injection of pellets, for instance. So they modify that treatment protocol based on their expertise. And what happens is, based on that feedback, which we also use AI for, how is that working for the individual? Get all the different biomarker data. Then it can say, you know what, Dr. Smith, Len, there's 100 people similar to Len's genetics that took this protocol and showed that it was efficacious, that it worked. So this is the protocol that's being suggested. So it's always learning, and every single time there's a new consumer that's using it, it gets that much better.
Awesome. If we're wanting to do a genetic test, I know there's so many companies out there. Are there a lot of things that we should look out for and to avoid?
There's a lot of companies that are out there for humans, people versus doctors. So that's the difference, whether you're going to do a test that is you get it through your healthcare professional, and there's somebody to review those results with you that understands how to read it. That's one. Also, data. What's happening with your data? How is your data being protected? Are you HIPAA compliant? So those are all the things that you want to do. And most of the tests, I call them the now, okay, so what kind of test. Just because you have a genetic predisposition to something, what does that mean? So you found out you have a predisposition to eczema. Okay, what do you do about that? And not being able to bookend the experience with a suggested treatment plan. Here's what you can do to prevent that. Take this, and this, and then monitor how well that's working for you. That's really the questions that you want to ask the people who are making these tests or your healthcare professional, to make sure that you're not just getting data, that you're left with, okay, now what do I do about that?
That makes sense, because we can kind of get overwhelmed by the data unless we're like working with a professional. So yeah, I definitely see how it can be valuable. I mean, personally, I got a test done like 5 years ago, the DNA company, and I was already like dialed in with my health and all that, so just kind of like tuning things up. So that's I mean, people do it for a variety of reasons, right?
Yeah, I mean, people do it to find out what genetic predispositions they may have. They may want to, as you said, if you're into biohacking, longevity, health span, you may want to see, are there any certain genetic markers that are unique to you? And the thing that we also do, we can take raw data from other DNA tests. You can take that raw data, upload it, and we'll translate and provide you a report as well. So that's another thing that we do, a lot of companies don't do. But the idea is we are focused on providing a decision support platform for healthcare professionals. That's really what our goal of our company is. And the reason why is because a lot of healthcare professionals provide sick care versus healthcare. And, that's the way our system is set up with insurance, etc. But if we can provide a path, so you can collaborate with your healthcare professional to create a plan that's specific for you, and both of you will be in alignment. You have knowledge, they have knowledge. But the idea is, for a healthcare professional, it's not to cure you, it's to do no harm. So if you're working with your healthcare professional as a partner, now you can find a path that may be individualized to you. And then you can take action specifically based on your own epigenetic expression, and collaborate with your healthcare professional. I think that's really a huge differentiator between us and other genetic companies. And the other thing is the use of machine learning, because you're actually not just using one piece of data. You're gathering data from everywhere, every single database that exists, and feedback from other people. It's always learning. So it's always a step ahead and teaching itself, creating those sort of guardrails for itself as well.
That makes sense. Really being the setting of your health professional acting like a coach, right? Because like you said, we live in this medical model where things are kind of almost dictated to you in a sense, and it's really based off of information that isn't accurate in most places. I mean, I think the medical system definitely has its place. It has a lot of value. At the same time, we're terrible at chronic disease. So things like this can be a very valuable tool.
I talk to people a lot about, different conditions that are being expressed. And, a lot of chronic disease can be caused by inflammation. And inflammation comes from many different factors. So I'll give you an example. This is endocannabinoid system related, but if I'm walking across the street, a car comes out of nowhere, almost hits me, I'm going to have a response. My response is going to be that fight or flight response that everybody has. So I'm going to excrete neurochemicals, some adrenaline, some dopamine, some norepinephrine, some cortisol. Once my brain realizes there's no lion chasing me in the jungle, now there's a couple things going to happen. It's going to reuptake those neurochemicals and it's going to excrete new neurochemicals. So some of them to get us back to homeostasis and balance are neurochemicals like anandamide. The word ananda means bliss in Sanskrit. So this is our bliss molecule, and also something like 2-AG. So what happens is once we excrete those, and if we have a genetic predisposition, and there's a gene called Fa, fatty acid amide hydrolase, that gene produces an enzyme that actually breaks down or metabolizes anandamide. Now, if you don't know this about yourself, you're actually not producing enough anandamide to be able to get your body back in homeostasis. So if that's the case, the cortisol that's been excreted can stay longer in your bloodstream. And when it stays long in your bloodstream, there's a couple things that can happen. It can reduce your pH level, make you more acidic. It can actually promote an overactive immune response, like a cytokine that we learned, during COVID. So now you can experience inflammation. So your inflammation can start in your joints, your ankles, your knees, your hips, your neck, your back, etc. And if you have predispositions to gut health issues, it can move into your gut health and trigger those epigenetic expressions. So if you go to a doctor, as I was talking about, and you're complaining about knee pain or joint pain, well, maybe there's an injection for that. Maybe there's a pill for that. But it's being caused by cortisol that's staying in your bloodstream longer because of this genetic predisposition. So understand that you have this, you can subsidize with other types of supplements and nutrients and stuff to be able to stimulate your own production of anandamide to get you back to homeostasis and balance. And that's an example of how understanding your genetic predispositions can help you get ahead of some of these chronic conditions.
That makes a lot of sense. I mean, because not everyone is going to be predisposed to like all diseases, right? So knowing those specific things, that can be a lot of value, like diabetes, for example, like just knowing these things. And there's so many examples, but getting a hold on that, it's definitely can add a lot of value to our health.
Yeah, and it's interesting you bring up diabetes. So I was privy to sit in a large conference call or Zoom call with a lot of the providers and a lot of the pharma companies, and they were talking about the epidemic of diabetes, and which is the number one epidemic they're trying to address right now. Why? Well, I mean, look at the food that we put in our bodies, so it makes sense. And I'm not talking about hereditary diabetes. I'm talking about diabetes that you actually can, establish yourself based on lifestyle choices. So their main goal was to talk about the reduction of the price of insulin. They were trying to see how they can get insulin reduced from lower than $1 a day. And I was sitting there listening when it was my time to ask a question. We were given a chance to ask some questions. I was saying, well, that's fine. That's already expressed. That's already happening. What are you doing to help prevent the expression of the predisposition? And they were like, oh, we have programs for reimbursing people for gym memberships, etc. But does that make fiscal sense for big pharma to prevent something from happening versus, maybe selling them medication while it's already happening? So we have to get a better handle, better sense of our own health and wellness, so we can do that ourselves instead of taking medication that may be not, financially a good investment for big pharma.
Yeah, that's crazy. I mean, recently, like the ADA, they admitted that you can heal diabetes naturally through lifestyle. The crazy thing is the treatment hasn't changed. I mean, they're doing the same thing, but they finally admitted it. We know it for a long time, but it's good to at least have that confirmation, so we can at least further research and do more for people.
Yeah, exactly. Agreed.
So I know you talk about precision medicine a lot. Would you like to define that for people and get into that?
Yeah, I mean, precision medicine is personalized. We're not at a point where we're doing individualized medicine, but the way I look at precision medicine and the way we work as EndoDNA, we start with the whole genome. We pull in the whole genome. The second part is our biomarkers from your blood work. So any blood work markers that come in, so you have your biomarkers from your plasma, your blood, etc. And there are specific values that are values which are standard or they're above and below what the standard is for an individual. The other thing is we get baseline biological age, which is how you methylate. Now you're looking at all these things, and now you're making a recommendation or a treatment protocol that's specific to that individual. Now, when I said it's not individualized yet, and I'll explain what I mean by that is, so it's specific to an individual based on those factors. The idea of precision is now you're getting that person a protocol that's specific to them and maybe a preventative protocol. So hence like hormone optimization or things like personalized supplementation, nutrients, vitamins, things that you may want to consume yourself based on your genetic predisposition and the other markers that I mentioned. And then what you would do is the system puts people in buckets. And Len is a certain genotype that have taken this protocol and showed that it was efficacious. And when you're saying precision, it is really a personalized approach to health and wellness and not reactionary. So you're being proactive with your health and wellness instead of reacting when something is already expressed.
That makes sense. Is there a lot of testing for people that would go into that to like pinpoint certain issues?
Yeah, so we are a decision support platform for doctors. The testing that we do is genetic testing. So it's a saliva test. You swab the inside of your cheek, you register, you send that sample to our lab. It takes about 14 business days or so to get your results. You log in. It'll tell you if you have a predisposition to certain things. So the platform is color coded. Green means no variant detected, no genetic risk. Yellow means there's a variant, so there's a risk. Red means multiple variants, so an especially higher chance of that symptomatic condition expressing itself. And when it's several, it's called polygenic. So there's not just one gene, it could be several genes that are associated with the expression of a condition. So once you know this about yourself, you can actually create the treatment protocol that's specific to that individual to help prevent the epigenetic expression of some of those factors that you may be predisposed to. And the kicker from there is the feedback. And the feedback is, how well is it working for me? Well, one way is patient-reported outcome. So I'm telling you that my pain went from a 10 to a 5, and I'm feeding that back through an app and saying that my pain has reduced. What else? Well, there's things that are not not as proactive for the individual, meaning that we can get biometric data from your wearable device. So if you have an Oura Ring, a Fitbit, etc., that data goes into the cloud as well. All those factors, and then the next part is your changes in your methylation. So your biological age changes. So for instance, I'm 53, my biological age is 47. What I like to have is my biological age should be reduced to 40. So I'm doing a certain protocol, and I'm going to measure that in the next 6 months to a year to see if my methylation has changed, so my biological age has reduced. Once the platform learns from that, now puts people in buckets and saying that there's 100 people who are similar to me with my genetics that have taken this specific protocol and showed that it was efficacious.
Got it. So is functional medicine very similar to that, or are there any differences?
Well, functional medicine is the practice of medicine. So we are a tool for functional medical professionals to be able to use so they can practice that. Functional medicine and integrative medicine is trying to figure out, it also combines some of the Eastern medicine techniques, trying to figure out the root cause of something versus reacting to the symptom that's being expressed. So asking yourself a little bit more, why is this happening? And we're the platform for functional medical professionals to use and answer that question. And versus, that whole my elbow hurts, let me give you a shot or a pill for that, versus, well, why does your elbow hurt? Let's follow it down to see, oh, it may be inflammation based on stress or something else.
Yeah, it makes sense. Like you're saying, we are definitely a lot of reactive care in terms of our healthcare system. Like a sick care system, and basically uh, we're just treating symptoms over and over again, and we're never getting an underlying cause, right? So getting the functional medicine, the precision medicine, so we can actually know what we're doing in a sense. I think that's the best way to wellness, because what we're doing right now is clearly not working. I mean, we're the most chronically diseased society in the history of the world.
Yeah. You know, part of it's on us. Part of it's on the healthcare system. Part of it's on the insurance system. So everybody thinks, I'll go to Canada, I'll get socialized medicine or some other country, and that's going to solve everything because of insurance. That's not the case, because you're going to wait for a specialist for 6 months. We still have a system that needs that you need to be in partnership with your healthcare professional. You need to be the person that's taking care of your own health and then helping your healthcare professional with maintenance and getting ahead of these things. Knowledge, I mean, it's cheesy as it sounds, knowledge is power, but what else matters in health? Yeah, I work with so many different wealthy individuals and people that they're trying to, create businesses, and they have all these different problems, everything that's going on in their lives, their families and all that stuff, their business. When you're sick, you have one goal. No matter what goals you have a lot of different goals. We write down our goals, but when you have sick, you have one. It's to get better. So isn't it important to try to get ahead of that before it expresses itself, so you don't have to worry about your health and wellness? Live, we talk about longevity too. Well, longevity is not really the end all, because we had a situation in my family, somebody lived till 100 years old. The last 10 years of their life, they weren't living, they were existing. Do you really want to live, and wear a diaper for the last 10 years of your life? Or do you want to actually live and enjoy your life? So health span, I think, is more important than longevity. You want to live your life to the fullest as long as possible while being healthy, cognitively healthy as well. Look, we're in the middle of a clinical trial for an Alzheimer's drug right now. And we're working with a company that's created this Alzheimer's drug. But the interesting part about that, in our initial phase 1 clinical trial, they found one specific genotype that this drug doesn't work for. Now, if you're going through a clinical trial without doing that, it'll be like, oh, this drug may not work. Well, it's not approved by the FDA, but it doesn't work for a certain genotype. So when you know this, you can swab people up front, know that they're not included and they need to be, on something else. But this drug works for 95% of the people. That 5% are outliers. So these are all the different ways that you can use genetics to make a determination of what works, what doesn't work for people.
Definitely, like you said, getting ahead of things, that's really where it's at, because, yeah, we can heal from most diseases most of the time, but isn't it much more easier not to get it in the first place, right? So getting ahead of that in terms of nutrition, sleep, exercise, and all the things that we talk about. And I really feel like things are changing. Things are getting better in terms of awareness. Do you see the same thing?
The awareness is coming much better. I mean, these kind of platforms, podcasts, it allows people like Peter Thiel or, Huberman, all these people to be able to start talking about these subjects to the masses. And people like even Joe Rogan, this is introducing people at least to question. And I think that, we question a lot during COVID too. And, we saw what happened with that. So I think being more in control over your health and wellness, the tools that, AI provides for us, we can be in better control over our health and wellness. And as you said, get ahead of a lot of these conditions before they express themselves. But there's also these patterns, like the example that I was giving with stress, with cortisol release. One of the things that can actually lead to, so I have a predisposition of bruxism, grinding your teeth. Now, if that stress level is not controlled during the day and you suppressed it, at night you may be grinding or clenching. So if that's the case and you're measuring your sleep, you may not be getting restful sleep, so you're not resetting. And if that's the case, now you're on this hamster wheel. Now you're agitated during the day, and it continues on, and you don't know. And some people are like, well, I sleep for 7, 8 hours a night. Well, what's the quality of your sleep? It's not about the quantity, it's about the quality. Are you getting really good restful sleep? Well, how do I know this? Well, if I know that I'm predisposed to grinding my teeth, now I can do something about that. I can have a daytime regimen. I can have a nighttime regimen. And these are the things that are really important for you to know.
Definitely. Putting those things in practice is the most important thing because, like you said, knowledge is power, but it's not just that. It's knowledge applied is power, right?
Yeah.
Because we can have all this information, but what are we doing with it? Like,
Yeah.
it's great to know about these cool things, but are you putting it into practice, right?
Yeah. It's the thing that I was saying now, so what? So there's so much information. People get information overload. We're overwhelmed with information. We're getting so much everywhere. How do you know what's true, what's not true? You know, AI hallucinates as well. It may give you wrong results sometimes. So you need to understand what it is about yourself. The more information you have, the better, but you're absolutely right. It's the implementation of the information correctly. And if you have good people around you, build yourself a team. Build yourself a team of healthcare professionals that are aligned with you on your mission. What is it that you want to do, and how do we get there? Check in with them. Give them information as well. Share that information back and forth, but be accountable for yourself. This is not, when I was a kid, my grandfather had a stroke, and I'll never forget this visual that my grandmother would sit at the kitchen table with bags of pills. Every couple months, he would have another thing that happened. And they were changing their dosing, and all of this with drug interaction, etc. And it was like, you're relying on pharmaceuticals and healthcare professionals to give you those things, but you have to be able to be in control of yourself. I'll give you one other example that just happened recently to an individual that I know. So, really successful business person had a venture that didn't go well. Now, I know this about him now because I did his DNA test, and I know that he has a predisposition to depressive feelings. So that depression gene is prevalent, and when things didn't go well, even though everything else was going good in his life, it just focused on that, and it triggered epigenetically his depression gene. So now he fell down depressed. He went to a psychopharmacologist, a psychiatrist, and he got a prescription of an antidepressant. He doesn't live in Los Angeles, but he was in Los Angeles with his kid and his wife, and he was driving around the canyons. And he said, I had an overwhelming desire to drive off the cliff. He goes, it was so real that I had to pull over and get out of the car. So luckily he did that. His wife came out, you're okay? I'm not okay. I should not be driving. So great, his wife drove. When he went back to the psychopharmacologist and did a pharmacogenomics test, first of all, it said that drug was red. It was the wrong medication for him. That medication, the side effects of that medication was suicidal thoughts. He was expressing those suicidal thoughts, but the kicker above and beyond that is he also had a predisposition to treatment-resistant depression. So the medication wouldn't have worked for him anyway, most likely, but he would still get the side effects of that medication. This is an example where understanding and knowing this about yourself, you can have a conversation with your healthcare professional and ask them those questions in advance.
Very interesting. Yeah, because we want to make sure our healthcare provider has the same goals as us. Like, if you want to get well and they're saying that you can't do it, you need to find someone else at the end of the day, because they're taught a certain toolbox, which has its place in certain instances, but it's very incomplete for the most part. And if we state our goals clearly and they're not able to help you with that, you need to believe them and move on.
Yeah. No, I agree with you 100%. That's the whole thing. In my past kind of part of the career when we first started, we dealt with a lot of cancer patients. A lot of cancer patients that were end of life, given 6 months to live or less than a year to live. and they survived and lived. Some of them still alive. Some of them lived till, instead of 6 months, 6 years. And it's the mindset of, and I started this conversation by having, my own diagnosis of attention deficit disorder. When you're given a diagnosis and when you're told, your brain starts thinking and acting like that. Oh, disorder means I have a dis-ease. There's something wrong with me. When there's something wrong with me, now I'm pursuing that to try to address what's wrong with me, instead of saying, well, my ADD is my superpower. It's not what's wrong with me. It makes me unique. I know how to use this correctly to, multitask effectively when other people don't. So the mind and body connection is pretty incredible, and understanding what it is that you're doing with it, your healthcare professional, as you said, your goal, and aligning those goals and being able to take action along those goals is truly important.
That's absolutely right. I mean, with Bruce Lipton, right, he talks about epigenetics, and the most potent epigenetic controller is the mind, how we frame things.
Yeah.
Because that's like where it's all at, is where it dictates our actions, and we can talk about like psychoneuroendocrinology, psychoneuroimmunology, and basically how our thoughts and emotions really impact our state of being and our whole biology. That's so impactful.
Look, I don't know if people realize this, but we have this vagus nerve that goes from our brain to our gut. We have our gut feel. It actually is learned experiences that are stored in our subconscious, that our gut bacteria or our gut microbiome knows and understands, reacts and responds, sends signals back to our brain. So there's constant communication from our gut to our brain and vice versa. And this communication, this highway through the vagus nerve, is extremely important, because when you're believing something, your brain already thinks it's real. And it sends those signals from your brain all through your body, and your neurochemistry and other parts of your body react and respond based on that thought process. So you're absolutely right. The first thing that we need to do is frame things correctly in our minds. And our brain is able to, I've seen this so many times where people believe, like, I don't believe the doctors. I know that I can heal. I know it, I believe it, and I'm going to take action. And there's some people who say, you know what, that's it. There's nothing I can do about it. So, if you believe that, you're right. If you believe the other thing, you're also right. It's what you choose to believe.
Absolutely. I know that very well, man. I mean, people know my story, but I had Lyme disease, and the number one thing that kind of did it for me was the mindset part, the belief that it can be done, and just it's absolute conviction that I will get well. And because you leave no other way, you start asking different questions, and you're presented with different answers, right? And it's not that the solutions for people aren't available. It's just that we're not receptive to them based off of our mind and the questions that we ask ourselves.
I also think, there's a mentality. I had a chance. I was just traveling. I came back in town. I had a chance to see my family in the East Coast, in Philadelphia, and New York. And we're talking to my parents, and they're big believers of the healthcare system. That's the way they're brought up. Doctors know better. Doctors know everything. That's the way they're brought up. And I'm not saying they don't know better in some people, but it's still this collaborative journey. And when you start believing things that can't be done, you set yourself on this mission of that it can. And I really strongly believe that your mindset it's one of the most powerful tools to healing that you can possibly have. Now you have to combine that with taking action. Just because you believe and you sit there on the couch and you're, stating your mantra over and over and over, I'm going to get well, I'm going to get well, doesn't mean that you're going to get well. It's a start. You have to take action. And action is probably one of the most difficult things. Here, I'll tell you, we have a feedback loop. When people are sick, they respond. They feedback, oh, I'm feeling better. When they start feeling better, the incentive is no longer there for them to continue to respond. They don't take action. Same thing as, you do your New Year's resolution to go to the gym. Well, you go to January and February to the gym parking lot, it's packed. March, April rolls around, I have no problem getting a parking spot at the gym. You know what I'm saying? So being able to be accountable, I think that's number one goal. The doctor has their own practice. They have many different patients. You are your own patient. You have to be accountable to yourself.
Right. I mean, you are your first client at the end of the day. Like, you have to work on yourself and really put these things into practice. Like, I was talking to someone the other day who was telling me their healing story, and he was working with a few doctors beforehand, and he told them how he got well. And of course, he heard the classic answer on it is this has probably nothing to do with what you've just done and worked so hard on. It probably just happened um, as a spontaneous remission, or he just kind of he doesn't ask questions on how it happened. Like a curious person, an intelligent person is actually curious, right? Asking certain questions so we can actually learn from it. But if we're just closed-minded, then we can't really extract the wisdom from just what happened in front of us.
Yeah, I mean, like I tore my meniscus in my knee, so I went to a bunch of different doctors, and yeah, I have a friend of mine who's an orthopedic surgeon. He's like, you know what? It's on both sides. He goes, I'll just cut it off. I'll go in there. It's like a hangnail. I was like, well, let me ask you a question. I'm very active. Like I hike all the time. So in what's going to happen in the next 10, 15 years if you didn't replace it, you cut it. So it was this big and whoever can't see, it's cutting, let's say it's half of the size that it was. You're not replacing it with it, you're just making it small. It goes, well, if that's the case, maybe 10 to 15 years, you probably need a knee replacement. I said, okay, I'm not willing to do that. Are there alternatives? So yes, as you continue to search, there are alternatives. There are stem cells. There are exosomes. There's other things that you can do to put in instead of take out. When you take out, scar tissue, all these other things are options. But the point that I'm trying to make is if somebody says do this, maybe ask 3 or 4 people and get their opinion and then make a decision that way.
Yeah, getting a second opinion is very important sometimes because, I believe it's like, I don't remember the stats exactly, but like when you see a different physician for the same issue, like 80% of the time is going to be a different diagnosis. It's kind of insane. And getting these things passed through multiple people can be effective. It's asking different questions because at the end of the day, it's our bodies, right? We have to do what's best for us. And these procedures from Big Pharma, they take a lot of time and money as well. And a lot of them are repeated as opposed to regenerative medicine, just a one-time thing. So I think that's very good insight there.
Well, the one thing AI is going to be used for and is being used for now is the diagnostic part of it because humans make mistakes and AI makes much less mistakes. So your MRIs, your CAT scans, your X-rays, all that stuff is going to be fed and they're going to be able to not only compare and see, but compare with millions and millions of other records and historic records to see what's going on. So we'll have a lot more precision in terms of diagnosis of any of those kind of scan tests as well.
Awesome. Do you see any diagnostics like that available at the moment?
There are diagnostics available like that in the moment. There's a bunch of different companies that are using AI to be able to evaluate MRI results, CAT scan results, etc. for specific conditions, and then be able to compare that with databases of tumors. There's a tremendous amount of advancement in the oncology space for looking at tumors. So it's not just, let me talk to a couple of my colleagues. You're able to tap into a database of millions of similar tumors and see what the effective protocol was for those tumors. That's happening now.
Incredible. I mean, I would imagine it's kind of growing in a sense in terms of like the testing and all that. Is it a new thing or where are we at with that exactly?
I mean, genetic testing has been around for 50 years. We've done it for like BRCA1, BRCA2, breast cancer, other things. But the amount of data and the amount of information and accessibility to data and using machine learning makes it much more accessible to everybody. And now we're able to scale that much quicker and tap into a lot more information. Look, when we first built our test in 2017, we had an 80-page report. You have to physically create huge spreadsheets, interpret information, be able to find patterns, be able to tap, different databases or just one database like PubMed. But now with AI, you can scale that exponentially. You can interpret the data much better. You can get all the data from every single database in the world almost instantaneously. So yeah, it's growing much more rapidly because of the technology advancements that we have right now.
Incredible, yeah, because we've been doing a lot of testing, um, and being able to use AI to be more precise with it. I think that can be a lot of value for people. I mean, because there's so much that we don't know, and just getting a lot of like what do you call it, metadata,
Hmm.
basically kind of feeding into certain algorithms and things like that. I have to learn more about that myself, honestly, but I think it's pretty cool.
Yeah, it's incredible, and we're only in the beginning of this. Eventually, what's going to happen is we're going to be able to prevent conditions from happening because we're going to have a monitoring nanobot that's within our inside our bodies. So
Hmm.
our own nanobot is going to check to see based on our own self, our own microbiome, our own levels, it's going to alert your an app or something like that if something is dysregulated within our bodies and be able to address that way in advance before anything is expressed. The future of medicine is extremely exciting.
Hmm. Very cool. Yeah. So we talked about so many things during this interview. We talked about like the epigenetics. We talked about DNA testing, all these different types of things. We kind of went into different things in terms of the mind, which was really cool.
Yeah.
Uh, is there anything you'd like to add for the people?
I just think that we need to do a better job in communicating with our healthcare professionals what else is available to them and not just go with this cookie cutter approach. And I understand, we're not covered by insurance, so I understand that that could be a challenge for certain people. But the more we ask as consumers, ask our doctors to take a look at other technology and question. Question is the main thing. Question as much as you possibly can and find out as much as you can about yourself because you are your most important customer.
Absolutely, man. Appreciate you so much, and I know you add a lot of value for people. Maybe open up some open up some minds to new things and ask a lot of empowering questions. So I know people that want to get connected with you and your information. Where can they go?
They can go to endodna.com, and I'm available on all social platforms. Len May on Instagram on Len May DNA, but everywhere else just Len May. So you can find out. I'm accessible. Ask any questions that you want. I also have a book. It's available on. I have a second book coming out shortly on Amazon. The current book is called Making Cannabis Personal. I also have a podcast called Everything is Personal, so you can check me out on all those platforms as well.
Awesome. Once again, thank you. It's been incredible.
Thank you, Anthony. Appreciate it.
All right.